Science Digest Show, Demystifying Science.
Akwaba, Wezolo, and welcome to the Science Digest Show, brought to you by SMC Consult, so much for Christ, to the ends of the world, SMC Consult, to the ends of the world. We are proudly brought to you by Pandit Photography and Therapics, located at Santa Maria. We are sponsored by Advocate Healthcare, located at Lakeside Estate. Trust Advocate Healthcare for all your health and dental needs and prosthetics. It is located opposite the Sweden Ghana Medical Center. And also we are brought to you by our noble main sponsor, EPP Book Services. We are currently at the premises of EPP Book Services, and you can see that we are backgrounded by medical books, different kinds of books, books on technology, books on space engineering, books on aeronautics, books even on hairdressing, books on relationships, novels. And they have an eatery here. They have also a playground and a cinema, a 12D and a 9D cinema known as New Zealand. You can bring your kids here. They have caretakers who take care of them. They can play all day whilst you work, and you come for them at a specific time of your choice. Today on the show, we are also sponsored by Unique Cost Limited. Trust Unique Cost for all your plumbing and household needs, including electrical outfits and all. You can reach Unique Cost on 0244 599 951. That is 0244 599 951. Or you can reach them on the Airtel Tigo number 0270 203 331. That is 0270 203 331. You can also be on this show as a startup, and you want to come and talk about your startup or your technological inventions that you are doing, because Science Digest Show, on this show you can reach us on 054 859 3815. Let's take it out again, 054 859 3815, and the last time 054 859 3815. Enjoy the show as we host an astute group, an august one of course, which is into scientific engagements known as Vacation Initiatives in Science Africa. Vacation Initiatives in Science Africa, VISA for short. They also have a slogan, Visa to Science. We have a nice man here, a good virologist, who will tell us more about Visa. Welcome, sir.
Thank you.
All right. Your name, please, and what is Visa?
So I'm Sebastian Eugenatha.
Okay, Sebastian Eugenatha.
Yes,
okay.
yes, that's my name. I'm a Ghanaian, okay.
All right.
I mentioned my name, and without seeing my face to relate to it, you can't really tell. But yeah, so I'm a Ghanaian from the Fanti land where we normally use the English names. So yeah, Vacation Initiatives in Science Africa started as an organization, an NGO, okay, non-governmental organization, which was to actually get involved in teaching children science in a practical way. Because we realize that what we normally get is science that is devoid of practicals in Ghana. Well, some places are doing well, but for the most part, you don't get that. So we initially decided to go to deprived areas of the country where science is not a thing that you really want to engage in, because you don't see anything. All you see is stuff on the board, the blackboards. So yeah, that's where we started from. And with the advent of the pandemic, we have actually gone a little bit into infectious disease science. When we started, we actually started with the notion that it will be very important to do something that people can see. And okay, we are in a country where epidemics are actually something that we can't evict from the system. So we thought we would start with things that are common to the kids. So we started with infectious disease like measles.
Okay.
And yeah, so far we have done interesting stuff with some kids in Nkraka in the eastern region. Okay. And we work with volunteers from Noguchi Memorial Institute for Medical Research. Okay. We also work with people from White Bay at the University of Ghana. Okay. And
that's West Africa Center for...
It's really long, so I normally don't say everything. If you want to know, White Bay
for cell biology and infectious pathogens.
Yeah. Okay. So, there are some interesting scientists there who are very invested in this area of research. Infectious disease research. And we also work with volunteers from other universities across the country.
Okay.
Anyone can join. That's how interesting it is. And
Wow.
please, the ladies can join us
Okay.
more, because we want to have these kids knowing that science is not limited to guys.
Okay, so like a
Everyone can
women
do
in STEM
science.
sort of thing.
Exactly. Which we actually have an event coming up.
Yeah.
So
which was curtailed by the pandemic.
exactly.
5
But
days.
you know what? It's not going to put
Lockdown.
us off. We're going to come back. so
Sure.
strong and we'll
Watch
do
out.
that.
Watch
Yeah.
out. Watch out.
Yeah. So,
Wow.
yeah. So
Interesting.
that's Visa.
Okay, that's Visa for us. Anyway, so where have you been apart from in Krakan? Can you give us a trajectory of maybe some places you've been to?
Yeah, so we started with our pilot project was in Accra, Laboni
Okay,
SDA.
Laboni SDA.
Yeah, Laboni SDA.
Opposite Laboni School. Sort
Opposite
of.
Laboni Second.
Okay.
I mean, it's adjacent also.
Adjacent.
I don't know where their
I
main
think-
entrance is, but it looks more adjacent than
Okay,
opposite.
okay.
Yeah, so we did our pilot event there. We've gone to Queen's Court
Okay.
in Tema.
Ajay
Kojo, yeah, Queen's Court International School. We've also been to 2 secondary schools in the Eastern region. I mean,
Okay.
in the 2
Oda
secondary
Secondary-
schools, we had Oda Secondary School, and then we also had St. Francis
Okay.
Xavier, I
Okay,
think.
okay.
And then we also had Atifa Secondary School.
Okay.
So Atifa and Xavier were done in, I think Atifa, the school is Atifa, that's where we did the event, and then we hosted St. Francis. And then we also did in Oda Secondary School. This was sponsored by the AAA Foundation and the Community Hospitals Group.
Oh, Akwesiakwa Foundation.
Alexander Kusiakwa Foundation.
Okay.
And we also did bring Professor Ian Goodfellow from University of Cambridge,
Oh.
who joined us to interact and then also have some activities with nurses and healthcare professionals
Wow.
on how to prevent nosocomial infections.
What's the
Which is,
nosocomial infection?
which is hospital-acquired infections. So
Okay.
if you are working in the hospital, you can get disease from the patients or anyone who visits. Anytime you get an infection from the hospital, that is what is termed as nosocomial. So
Wow, we've
that's
learned
the-
something new. Nosocomial infection.
I like the word though. I don't like the disease, but I like the word.
You like the word nosocomial infection
Yeah.
or hospital-acquired infection.
Right.
Wow. So okay, so this one happened where?
So this happened in Oda
Yeah.
Hospital, I think the General Hospital.
Oda General
Yeah,
Hospital.
yeah.
Wow. When was this? Which part of the
So
year?
this happened in January, I think with it from 4th to 11th or something like that.
Wow,
Yeah,
wow.
but I was in January.
So would you
Before
say
the pandemic. Came to Ghana. Before it came to Ghana.
that's what I was going to talk about. So
Yeah.
was it like a talk of the devil?
Not really. I mean, we had no idea. It was planned before the first case was reported in China. So honestly, it has no correlation with what is going on.
So
it's not like we did.
You're not
We did bring
implicated
the
in-
no, we are not. Implicated. I think we actually implicated in the good side. You know.
Okay.
Yeah, actually.
As a rescue mission, right?
Exactly. You know. So to me, I think it was timely and was on point.
Yeah, I think we launched the first video as Visa together with Healthivity
Right.
in different languages in Twi, Bisa, and Ga
Yeah.
to educate our people before Ghana even had a pandemic. We did the launch when I think Nigeria had their first 2 cases.
Right.
Is that right?
Right.
Yeah, and the video was really awesome, and we got the health minister, Honorable
what I saw.
Ajima Menu,
I think he
sharing it
shared
on
it. Yeah, he
Facebook,
shared it.
and other people sharing from Spain. You can
Right.
even share your
Right.
testimony. You have your friends.
So I have friends who shared, and then they actually suggested we do it in different languages. And
Wow.
we did.
Yeah, we did.
We were able
We
to do
did.
it, so.
That's a kudos. So, Monsieur President Ekufado, s'il vous plaît, endorse us, okay? Endorse us, okay?
Right.
Votez pour Visa. Alright.
Yeah, I
And
don't
give
understand
us-
what you said, but I'm sure he will understand.
Yeah, he will understand. Yeah. Il parle français bien. Oui. So, Monsieur Ekufado, we beg you, vouch for Visa and give us some commendation in your next fellow Ghanaians. Alright.
That's right.
So, how do you find our management so far in terms of the pandemic?
So when you say how do you find our management, I
As a
believe you're
country.
talking about a country. I think so far it's been good. Ghanaians have been a bit compliant. When we started, we were kind of stubborn because we're on the good side of the pandemic. Because you see that you have 2,000 cases, which in Italy you're going to lose like 1,000 people from. But in Ghana there were no deaths, you know, even when we're getting higher cases. And now we have about 40,000 cases, more than 40,000 cases, and we still have about 200 and something deaths, which means that we're on the good side. I'm not saying no death is important. Every death is important because every life matters. So I mean, to me, we've managed it very well getting to this point. But I think there's more we can do, you know, like enhancing medication and all that. Like our NGO, for instance, Visa, we have planned to come on board to help with education and testing and everything. We are still in the process of getting funding. And it's
Right.
one area that we really have to hit.
Speak to it.
Yeah, because
Speak to it.
without the funds, I don't think we can really win this fight. And the smaller NGOs you see around can be used as an instrument to actually put across good education in villages. I emphasize villages because these people don't believe the pandemic. They are not really facing the reality of the whole thing. Some people even think what we are doing here or what is happening in Accra is politics, you know. I think we have to take our mind off that. I'm coming from the UK where I know people who had the infection. I know close people who died, so I think it's something that we have to actually enhance education, and funding is really important. So if anyone has even one city who would like to have that in our coffers, and then we'll push that in the education towards eradicating this pandemic in any way possible.
Sure. At this point, you can give your number or your Facebook accounts and stuff.
Yeah, so when you go to Vacation Initiatives in Science Africa at gmail.com, you'll get us. And when you want to call any of us, the first line to get us is 050 382 5211, 050 382 5211.
Take it out.
I'm taking it last time. 050 382 5211.
All right. So the Vacation Initiative in Science at gmail.com, is it VISA abbreviated or info?
No, it's Vacation Initiatives in Science Africa
info
at gmail.com.
At gmail.com.
Yes.
All right. So you can write to them. You can also get them on the phone line. Do you have any handles, social media handles?
Yeah, we have Visa Freak 1.
Visa Freak 1.
Visa Freak. So
Visa
it's
Freak.
not Visa Afrique, it's Visa Freak. So VISAFRIC
Okay.
1.
Visa Freak
Yes.
1.
So at Visa Freak.
At
1.
Visa Freak 1.
Yes. And you get us on Facebook, you get us on Instagram, you get us on Twitter.
Sure.
Yeah, any of these handles you can get us from that.
Sure. And also, if you're at school and you are watching or an institution, post-COVID or when we open schools, you can come and do some engagements for your students. I think Ajay people have been calling the numbers.
We've had several schools calling in, and then this pandemic hit.
Yeah.
So we'll be getting back into the game.
Yeah.
And please, and it's so exciting, if you want to join this, we don't care the school you are. You can be a private school, you can be a school in one of those villages. We don't care. Anywhere you are, we are bringing science to you. Because you know what? We give visas to science. It's not visa to go to US, visa to go to wherever. But once you get a visa to science, you can actually get the real visa to go to US and elsewhere.
That's actually true. That's actually true. So the whole point here is that some of the students even call we volunteers, right? Mm-hmm. Have you received any call from some of the students, or they call in? Have you heard from any of your people?
Yeah. First of all, let me mention that because I'm not based here, they can't really interact.
Okay.
But they've engaged with our social media handles.
Okay.
And I think some of our volunteers have also.
Yeah. There's one Solomon guy who has been calling me.
Yeah.
I'm also Solomon anyway.
I think everyone in the volunteering group or in the group like Vacation Initiative in Science is an expert in the field. They can talk about whatever you want to discuss when it comes to infectious diseases. I know when this pandemic came, people were scared. These kids, for instance, when they heard that, kids are not getting infected, they were concerned. They're like, are you really sure? So they wanted to know more. So they would get to our pages and then they ask questions. And I know some of the volunteers actually testified that some of these students will be calling, asking about what their fate is in terms of the pandemic. So I'm so happy that I have experts in the field joining us, and we are looking forward to having more of such as well.
Wow. A great point to mention is the fact that these kids serve as faithful disciples to spread them. Can you tell us more? Throw more light.
Yeah, when you are engaging people, your targets, the best target you can get is kids, because they get so excited. They go out there selling what they've seen. They chat with their friends about these things and all that. But when you have parents or adults who have a lot of things on their minds, they'll just do it as a one-shot thing, and that's about it. They are happy. They see you the next night. They'll call you because they saw you, but they're not going to talk to people about it in your absence. These kids are happy with everything, and we can tell from back in the day when we watched Captain Planet and all that. We discussed this in schools. So when you have these kids doing hands-on stuff, learning, I think it's the best way to.
So there's a picture of me and the kids.
Yes.
Something like Captain Planet.
Okay, so it went off.
Oh, it did.
Because you get so many messages.
Sorry. I will fetch that out again. All right. So that's the kids and I think it's like a Captain Planet picture, isn't it?
Exactly. I like this picture actually.
Yeah, it's my favorite. It's on my phone, it's on my tablet, it's on everything.
And that's what we want to see. We want to put excitement on these kids, the faces and everything. It shows that they really enjoyed what we did. And honestly, I enjoy being with the kids.
Yeah, we miss them. Come on, please hurry up and open schools for us. All right. Yeah. So we want to give some shout outs to all your volunteers, your management staff.
I wish I can give shout out to all of them. But unfortunately, there are so many.
Sure.
Because this is an exciting area where we can't just use 2 people. But I mean, I'll mention some of them at random.
Okay.
And you know what? I just want to say thank you to all of them before I start mentioning.
Okay.
So first of all, I'll start with our own Nene, who is a chief.
Nene.
Of Nkrakai.
It's also a Solomon.
Yes, Solomon Bedu.
Yeah.
And we have Millicent Opoku from Noguchi.
Yeah.
We have Jane Noguchi. We have Esina from Noguchi.
Sylvester.
We have Sylvester from Whitebait. We have
Lydia.
Oh my God, we have a lot of people. We have Charles Prempe, Cambridge University.
Yeah. George Jansen.
We have George Jansen.
Yeah.
I mean, there are a lot, right?
Yeah, there are a lot.
I'm sorry if I'm not able to mention
your
them,
sponsors from out there?
Yeah, so we've had sponsors from Microbiology Society in the UK.
Okay, Microbiology Society, Hadi Rain
Development Initiatives. We've had from Wellcome Trust, Professor Ian Goodfellow,
Professor
Cambridge Africa program,
which
is a scholarship that I'm actually enjoying right now. So yeah, and over here, like I said, we have the AAA Foundation and the Community Hospitals Group.
Okay.
Yeah, and many more coming on.
Yeah, tell us about your publication, which went on 3 News.
Yeah, so I mean, this publication was only to let people know that, hey, we have a pandemic here. Don't be scared. Don't panic. Just relax. Take the precautions. I mean, that's the summary of it. And I use the influenza, which is not really a big deal in Ghana, but it's a big deal elsewhere. And basically, when you get that, you can infect other people. That's all it's telling us, you know. And the fact that you don't have to go to the hospital once you feel some symptoms. First, you have to call, because you are going to a place where most of them are immunocompromised, which means that they are weak. Their immune system is weak.
Immunocompromised means weak immune system.
Weak immune system, and these are normally people who are sick already. They're aged and children. Okay, they have weak immune system. So hey, don't rush to the hospital. Just call the number. I think it's 122 to 112. 112, I think.
112.
112. Yeah.
And we effected that decision.
Yeah, actually, we pushed that. We pushed that.
First was a long 10 days. Yeah, and then Visa.
Yeah.
And then Healthivity pushed it. And then they all listened.
Yeah.
So we thank God they listened to us, which has helped make things snappy.
Exactly.
Yeah.
Exactly. And I'm happy. You know, this part of the management.
Okay.
They listen.
Okay.
So when they listen, it's more things. I'm not trying to. You know, I hate to bring politics into this kind of issue because it's a pandemic.
Exactly.
There's something in the whole world.
Everybody.
So we have to take politics out. If you want to do your politics, I don't care. But I mean, as a virologist, I believe in supporting the government at hand to fight this COVID-19.
Okay.
And after that, you can do your politics, and hey, I mean, it's a game. You just do it and you're fine. but until then, I mean, let's support the
sure. Let's stay safe, stay home, and do the right things.
And eat well.
Yeah, I mean, take all the fruits and keep your immune system sharp and on point.
Exactly.
All right. So, how do you find your media engagement? I know you've been doing a lot. You did. Let me try and find the pathway. You did Star FM. You've done TV3. You've done TV Africa. You've done
Hope
Metro.
TV.
You've done Hope TV. You've
UTV.
done UTV. You've done Peace FM. You've done all these. How do you find it? Angel FM.
Yeah, I mean, it's interesting to get these opportunities because you want to be heard, you know, and that is your small way of fighting the pandemic. Let's just assume that you know all these things and you are not being heard. I mean, you feel useless.
Mm-hmm.
So when I got opportunity to speak on the media, I think it was a plus. You know, it felt good because I'm able to discuss the pandemic real time and educate people who will otherwise not have any idea. I've been able to, you know, educate people in Chi through Peace FM, for instance, Angel FM, UTV. And it's really good because when I come back home in the area, I get people saying, into can say this. You know, it gets you engaged. Otherwise,
you're a celeb now, isn't it?
Not really. I don't want to call myself celeb. Let's just hold that one. Okay. But I mean, what I'm trying to arrive at is you get people who come to you and follow the conversation, you know, follow up with the conversation you had to get more understanding. So imagine that I was in the area or I was just walking around. No one knows I'm a virologist. No one cares. But now they know I'm a virologist, they can ask questions and I can continue with education out there. Okay. So I mean, the media engagement is interesting. Yeah, and from every now and then I get calls, you know, to help with education. Okay. I think I don't want to say uju. No, we are helping to fight a cause. And that is most important here. After that, we can JRD. That is not the issue now.
Sure. So you're watching Science Digest show here, Yamne Fiko. We'll be right back. Stick around.
Digest Show, the mystifying science.
Cherished viewers, welcome back from the quick commercial break. It's been a nice time with the Director of Vacation Initiatives in Science Africa, Sebastian Eugene Arthur, a postdoctoral researcher and fellow of Cambridge University Department of Virology, Division of Pathology. Alright, so Sebastian, wrapping up the show, so what would you tell us as your concluding words? And
Yeah, I think let me just first correct. I'm not a postdoctoral fellow. I'm a PhD candidate. I'm actually finishing up in some few days. Wow.
Okay.
Yeah, and then I'll be taking up a postdoctoral fellowship at University of North Carolina, Chapel Hill, in the US. Yeah, and I'll be doing a break, like a bridge period with Whitehead.
Okay.
Yeah, I'll be doing some research in Whitehead. Yeah.
Okay.
So, I mean, to wrap up, I would like to let people know that, hey, Vacation Initiatives in Science is alive and well. And we are engaged in educating people on COVID-19, and our activities will be starting up very soon. We'll be doing our STEMs, like Girls in STEM, the Girls in STEM event. We'll be doing it very soon, and we'll also be entertaining schools, on this scientific engagement activities. We'll be focusing on infectious disease as we already started.
Okay.
So more activities to come. So.
All right. Give us the number again for Visa in case we want to partner with you.
Yeah, so if you want to call, the first line to actually reach us is 050 382 5211. 050 382 5211. And if you call, just look for Sebastian and I'll speak to you. I'll gladly talk to you and give you more directions.
Alright, that's a nice one. So Sebastian, where did you have your primary education, secondary, tertiary? Tell us about it.
Yeah, it has been a rough road, but all in all, it's been awesome.
Okay.
There's one thing I always say, that God does not really need a perfect beginning for a perfect ending.
Say that again.
God does not need a perfect beginning for a perfect ending. He doesn't care where you start from. If you want to make it great, he's going to make you great.
Oh, that's a slow again.
Yeah, that is God right there. So I started from St. Francis Preparatory School in Nungwa.
Okay.
I did only 2 years there.
Okay.
So class 1, class 2.
Okay.
And I moved on to Nungwa, Accra Metropolitan Assembly 5, AMA 5.
AMA 5.
Yes, AMA 5.
Okay.
I like emphasizing the AMA for people to know where I'm coming from.
Okay.
You're talking about
Charlie.
Yeah, we're looking at schools on the beach, those
wow.
schools, the deprived ones. Yeah, so that's why I went, and fortunately I was able to get one of the best grades to take me to secondary school at Nungwa, where I did science.
Okay.
So from Nungwa Secondary School, I did well, and I went on to do molecular biology at UCC.
Okay,
yeah,
UCC?
Yes.
Which hall were you in?
Oh my God, I was in the hall. I was in a university, and that is Casford, Casey Hillford.
Oh,
yeah.
Okay.
So I'm a Casfordian,
You have the right.
Yeah, we hold our balls any day. So so I was in Casford, UCC, molecular biology, and then I moved on to the US to do my master's. So I was at the University of Arkansas, where I did a master's in cell molecular biology. That's where my virology started.
Okay.
Yeah, so I worked on environmental virology, looking at how viruses persist in the environment. My focus was on norovirus, which causes disease in children and immunocompromised individuals.
What disease in particular?
So gastroenteritis, so inflammation of the gastric walls.
Okay, so gastroenteritis is the inflammation of the gastric walls.
Yeah, so the stomach lining.
The stomach lining.
The intestines.
The intestines. Okay.
Yeah, so which can lead to diarrhea.
Okay, diarrhea.
Yeah, children will lose their lives. Immunocompromised individuals will lose their lives because of dehydration, because you'll be running, you'll be vomiting and all that. So yeah, that's what I studied, and then it's gained me a very good position to start a PhD at the University of Cambridge, where again I studied virus and again norovirus. This time I'm looking at the molecular relationship between the virus and the human host factor. So you are talking about proteins in humans, okay, which helps the virus to propagate. Okay, and here when I say help, I'm talking about both the negative and positive. So it either destroys the virus or it promotes the virus ability to replicate. So that's what I'm looking at. And I'm wrapping up right now to get out of it, and then I'll continue with some interesting research.
So you believe in Prof. Ian?
Yeah, I mean, I'm leaving Ian and it's sad, but I mean, it's you have to move on.
Yeah, I like this one. Yeah.
But at this level, you still keep that relationship because you will be.
It was a good time with Ian at Cape Coast.
He's awesome.
Wow, the party after party.
Yeah, I know, right?
All right. So Sebastian has been a very good brother. He's been a good friend. He's helped me through a number of things, getting me Legos before the lockdown from UK, because I was finding it difficult to get Legos in Ghana. You know, it's a business you can start up. Think about it, because I love Legos. And also, he helped me to do my pandemic management called with Harvard. And then also the last time, this particular show, Science Digest show, we discussed it together about science journalism and all that, trying to do something to change the face of science. And Sebastian, I owe you a lot. So from the bottom of my heart, from the depth of my heart, from EPP Book Services, from SMC Consult, So Much for Christ, and To the Ends of the World, we present this book called The Thin Executioner. We want you to read something. Why a science be Queen's English.
We're good to learn more.
What's your fancy? To better you kakra my dema.
I'm gonna ask some of you present my book and I will talk about it. Okay, so my book first.
The song first, then the book last.
You know, I actually have a problem with my vocal.
When did you have a problem with your vocal cord, Sebastian?
In the morning.
Okay, so just give us the lyrics. The lyrics of your best hymn.
Oh my God. Okay, so there's this one that says, "Come, come, ye saints."
Okay.
Yeah, and it's basically inviting everyone to come and then lay under the feet of Christ.
Okay, come
with your labor. Yeah, with your labor, toils, and fears, just come to Christ.
Wow.
We have a living God.
We have a living God. Come, ye saints, come with your labor, your toil, and everything. Lay it at the feet of Christ. Matthew 11:28 says, "Come to me, all ye who are heavily laden and burdened, and I'll give you rest. For my yoke is weak and my yoke is light." All right. So Sebastian, from EPP Book Services on their premises at the medical corner of the bookshop, we present this book to you in the name of the Father, the Son, and the Holy Spirit.
Good job. You gave me this book in a medical corner. Good job.
That's the irony of it. Just to make you relax.
Thank you very much.
All right. Yeah. So what do you say to people? Your shout outs, your last shout out.
I mean, first of all, let me say thank you to EPP Book Services. I think this is a great thing they're doing.
Okay.
And the last shout out to the volunteers on Visa.
Okay.
I mean, you guys are doing great, and I appreciate you all. You know, on behalf of the children we are interacting with. Hey, thank you.
All right. I also give some last shout outs here to Dr. Sandra Hewlett of University of Ghana Medical School, and also to Dr. Cynthia Meni Dankwa of Faculty of Pharmacy and Pharmaceutical Sciences, KNUST, Kwame Nkrumah University of Science and Technology, and to the current Vice Chancellor, Professor Rita Dixon. God bless you for everything you taught me in pharmacognosy and for all the love and the motivation. We'll catch you in Kumasi very soon for an exclusive interview. On this note, we'll sign out with Dr. Nimako Boateng and also Dr. Edward Cranting, saying thank you to you and your family, your kids, and everybody, and to my lovely sister Charlotte and Edichuma Gloria. Science Digest show.
Science Digest Show, demystifying science.